Are you struggling from back pain? Do you find that standing for long periods of time is challenging and maybe leaning over, leaning forward, or leaning over on a shopping cart gives you actually some relief? You could be suffering from spinal stenosis. Today, I'm going to teach you about spinal stenosis. I'm going to show you my 5 go-to stretches for anyone who's suffering from spinal stenosis, which can help you feel better. Watch this video in its entirety because I'm going to show you all this stuff and I'm going to teach you how chiropractic can also benefit you and help your spine. My name is Dr. Shariff. I'm a local chiropractor in Oshawa, Ontario. My clinic name is Infinite Healing Chiropractic and Wellness Center. And our mission on this channel is simple. It is to help teach you how to optimize your health, how to live life to the fullest, how to live life without invasive procedures or surgeries or pills to start maximizing the inner potential you have. So watch this video in its entirety. If you're interested in learning more about your health and how you can maximize your potential, then subscribe to this channel, like this video. You will be informed on when I actually post out new videos. This is all about you and about living your life. So if you're interested in maximizing your potential, watch this video in its entirety. Let's start. Now let's understand what lumbar spinal stenosis is. So what is spinal stenosis? Generally, if you think about it, your brain communicates with the whole body through the nervous system. And what happens is your brain sends signals down the spine and out the nerves to the whole body. But what happens in stenosis is that the canal, which the spine goes through, that canal has lots of space for the spine to be able to go through, but over time, and many factors can cause this, and I'm going to explain to you what those factors are, but that canal, that tunnel, starts to get narrow, starts to get smaller. Now, it doesn't happen to everybody, but it happens. And when it happens, and that canal gets smaller and smaller, that spinal cord starts to get pressure put upon it. And that pressure builds up. And so when that pressure builds up, wherever those nerves are going to, they're going to be affected. Think about it this way. If you are watering your garden and you've got this garden hose and the water is coming out and then you go to put your foot on that garden hose, what happens to that water? It slows down. What happens to the water coming behind that foot? It's starting to build up. All that pressure is building up. And so wherever that water is going to that garden, that area of the garden is going to start to break down. It's going to start to deteriorate. It's going to start to die off. And you think about this, this is what's going to happen to your body because suddenly where that nerve flow is supposed to go to, it's not going because there's pressure around that spinal cord that is inhibiting that nerve from flowing. And so a lot of people think you're going to get back pain. Yes, you could. A lot of people think you're going to get leg pain. Yes, you could. You could get pain down the leg, numbness, tingling, all of that, loss of sensation down the leg. But guess what? Those nerves are just not limited to those areas. They can affect your organs. They can affect the way your body functions. So all these things can start to deteriorate. And so that's important to understand that lumbar spinal stenosis is just not limited to the spine. It can affect everywhere those nerves are going to reach out to. Every part of that body could start to break down and be affected. So people always ask me, how did this occur? How did I get here? How did I get to this state? Well, there's many different causes. The one most simplest cause we can talk about is arthritis. So arthritis is a factor that a lot of people have, and it could lead to lumbar spinal stenosis. And that means the ligaments, the joints around there are starting to get thicker. The bone that's actually building around that spinal cord is actually getting thicker, and that could affect it. Then you could have things like inflammation. That area could be extremely inflamed. And guess what? Arthritis itself is an inflammatory condition. So that inflammation is now taking up space in that spinal cord, and it's affecting that spinal cord too. Then you talk about bulging discs. Well, think about what a disc is. A disc is a shock absorber. And the best way to describe a disc is that if you look at a disc, the outside of the disc is very, very tough. The inside of the disc is it's like a jelly-like substance. And that jelly-like substance absorbs all the pressure. But your disc can bulge, okay? They can bulge. And that's a normal phenomenon. It's when the bulge gets so big that that disc starts to impact inside the spinal cord. So what happens is, you have this disc, okay, and the disc starts to bulge, as you can see right here, with this little bulge here, okay? So you can see healthy disc coming on right here, the space, but then you see that bulge happening, and that bulge starts to happen, and that starts to impact the nerve, the spinal cord, all of that through there. So when that bulge happens, okay, that bulge, it's kind of like a balloon with water in it, and you squeeze one end of the balloon, the other end starts to bulge. And it's normal for your disc to bulge, but when the bulge is so big that it starts to touch the nerve, the spinal cord, That starts to create your compression. That starts to create that narrowing. That starts to create that stenosis. So then you also talk about bone spurs. Bone spurs is a form of degeneration, degenerative disc disease. And when bone spurs occur, those bone spurs starts to build in that spinal canal, and that starts to impact that spinal cord, as well as can touch the nerves too. And then you talk about another condition called degenerative disc disease. Degenerative disc disease is when the disc starts to collapse because the disc, which should have a nice structure to it, starts to get thinner. And when that happens and that disc starts to collapse, it starts to affect and impact that spinal cord and that nerve. So all these conditions could start to occur. And if you look at an MRI report, an X-ray, things like that, you may find these things popping up on those areas. And that arthritis, that breakdown, that degeneration, that bone spur, whatever it is, could lead to stenosis. And that's something that we want to talk about in terms of how do we give you relief from stenosis? How does stenosis occur? What is happening here? And I'm going to keep on educating you on this. So let me review the symptoms of spinal stenosis first. So the spinal stenosis symptoms, what you're going to get is you're going to get back pain. You could also get numbness, tingling going down your legs, loss of sensation going down your legs. A burning sensation could also occur, but you could also have weakness happening in your legs. And normally, when you're seeing a lumbar spinal stenosis happening in the spinal cord, it's happening in both sides. Okay, both sides are being affected. When it's a foraminal stenosis, which means only the nerve is being affected, you may see it on one side. Okay, that's an important thing to understand. When it's your spinal cord, both sides are going to be affected. When it's just the nerve, one side is going to be affected. Now, your legs, you just don't trust your legs because they're going to give out on you and stuff. That's what you're going to start to feel. And you're going to feel that, when you're flexing forward, when you're leaning forward, when you're sitting forward, or when you're at the grocery store, just leaning on that shopping cart, that gives you relief. Those are signs that you may have lumbar spinal stenosis. And then you get into, where does a chiropractor fit in? Because we see a lot of patients that come in with lumbar spinal stenosis. How do we help them? Well, our premise of chiropractic is simple. We're working with that nervous system. We want to optimize your nervous system and your spinal cord. So what do we do? Well, our game plan is so simple. And I tell this to clients that when you understand what chiropractic care does, it really offends your mind because it is such a simple philosophy. These joints have lots of motion. This allows you to move. This allows you to live life. This allows you to do the things you want to do in life. But what can happen is these joints can get misaligned. And when they get misaligned, that nerve gets affected. The spinal cord can be affected. There's scar tissue that builds up in there that can affect all of this too, which can lead to inflammation. Remember, we talked about inflammation being an issue that could be an area of where that spinal cord or that nerve is being impacted. So as a chiropractor, I want to look for this. I want to find this. And so what we call this misalignment is a subluxation. So we're looking for these subluxations. And when we find these subluxations, it's so simple with what we do. We just put it back into alignment. That's it. We just put it back into alignment. Now, I'm not saying that one adjustment is going to cure spinal stenosis. One adjustment is going to take care of everything because that rarely occurs. It takes time. Healing takes time. So after a period of time, my patients start to notice with their continual care that they're starting to improve in their symptoms. It can become more manageable. They're starting to live life to their fullest. They're starting to do things that they didn't think they could do or they wouldn't be able to do in life. And you're living life with less fear. How many times do we say to ourselves, I don't want to do that. I got to avoid doing that. I can't do that because it's going to cause all kinds of issues. And man, if I get an issue, I'm going to be in pain for so long, or I'm going to be out of commission for so long. I can't work for so long. What if that could change? What if you could start doing these things with less limitation? Wouldn't that be a game changer for you? And that's what we love to see. We love to see this potential getting optimized with patients. So now I'm going to show you the 5 stretches I would also give to any client that has lumbar spinal stenosis, because it's only going to benefit you and help you get better. Now, one thing I'm going to say to you is that before you do any type of stretches, before you start to participate in stretches, you should always consult your healthcare practitioner. You should always go over things with a healthcare practitioner and review this. This is not medical advice, but this is education on how you can improve your health. So the stretch we're showing here is the single leg knee to chest stretch. Basically, the premise of this stretch is that it's going to help to flex the spine. It's going to take the stress off the nerves. And the game plan here is that we're showing this on a chiropractic table, but I prefer this to be done on a floor. And you're going to have your back on the floor, your legs down, your feet on the flat on the floor. Then the first step is you're going to bring your knee to your chest, and you're going to stay on the same side. Now, you want to hold this stretch for about a good 20-30 seconds, breathing slowly and deeply in and out. And I know a lot of people say stretches can be done for 8 to 10 times. I don't need that. I think that it's important that you do it 2 to 3 times, holding it for 20 to 30 seconds, and you get a better and a deeper stretch. Then when you're done, you're then going to switch legs and you'll do the opposite side. And now these stretches are designed to help stretch that lumbar spine, help to open up that canal, to take the pressure off the nerves, really. And the most important thing is that you shouldn't be feeling any discomfort doing this. You're going to the point where you feel that stretch, but you don't have to push it further than that. Hold that. Now, the other variation is that you can do the single knee to chest stretch, but you're going to bring it to the opposite side of your chest, and you're going to hold that. This is a very good stretch for your lumbar spine as well as the gluteal muscles, and helps to actually stretch out the muscles in the buttocks area, helps to open up that spinal canal, helps to take the stress off of it. And you're going to hold this stretch for 20 to 30 seconds, and you're going to breathe deeply in and out, and you want to do it 2 to 3 times. And then once you've done that, you then want to switch to the other leg and bring it to the opposite side of the chest. And this is a really, really good stretch. And as I've said before, you want to do these stretches on the floor. We're just showing it on a chiropractic table, so it's easier and safer to do it on a floor. So the next stretch is going to be pelvic tilts. Pelvic tilts are great because they help to reactivate your deep core muscles and teach your body what a neutral supported spine feels like. Over time, better control helps you stand, walk, and lift with less strain on the lower back, and it's critical for anyone with stenosis. So the premise of this is that you're going to stay on your back with your knees bent and your feet flat on the floor. Think about gently tucking your tailbone under and flattening your lower back into the floor. Then you're holding that position for about 10 seconds, and then you're going to repeat 10 to 15 times, moving your breath. And so again, you're gently tucking your tailbone under, flattening your lower back into the floor. Now, the next stretch we're going to talk about is the cat-cow. This is a great stretch. And so with this one, this is so good because it helps to encourage smooth, controlled movements of the spinal joints. It really helps to improve the circulation around your spine, and it can help the nervous system shift out of a guarded mode. So I find it very good because it also gets you into a calming and breathing state. So basically the premise is you want to be on all fours. Now, if you have issues with regards to your knee being on the floor, then you can use a pillow underneath your knees, and you can place that there to help support your knees. Okay, that's one option. Otherwise, if you don't need the pillow, that's okay. And you want to be on all fours with your hands underneath your shoulders and your knees underneath your hips. So you're in this position. Now, basically the most important thing is knowing when to breathe in and breathe out. So when you exhale, that's when you gently round your spine towards your ceiling. Tuck your chin in and your tailbone, as this is your cat position. Then, when you inhale, you allow your spine to gently arch, lifting your chest and your tailbone slightly. And this is your cow position. And you move slowly between the two positions for 10 to 15 rounds. So the next position is child's pose. This position is great because it naturally rounds the lower spine slightly and can put a soothing stretch for the muscles along your back. If kneeling bothers your knees, then you can place a folded towel or a pillow beneath your knees for support. Now, with this stretch, basically what you're doing here is you're starting on all fours on a comfortable position and on the surface. You're going to slowly sit your hips back towards your heels. And then you're going to let your forehead rest on the floor. And you can put your forehead on a pillow or a block if you want to a yoga block. And you're going to reach your arms forward and let them rest by your sides, whichever feels better, okay? Either by your sides or forward. And you're going to hold that for 30 to 60 seconds. And then you're going to repeat that 2 or 3 times. This is a really good stretch, really helps to stretch out that back. And anybody who's suffering from stenosis does find a great deal of relief through this. Now, these stretches should feel like you're getting some gentle relief. It's not supposed to be increasing your discomfort. It's not supposed to be increasing your pain. And if you are feeling that, then you need to stop. You also need to make sure that you're not pushing yourself too hard to do them. You go as far as your body allows you to go. That's an important thing to understand. And it's not about doing a lot all at once. You're going to overwhelm your body. That's an important thing to understand too, because it's about doing subtle things consistently over a period of time. You have to have a routine. Don't try and find time in the day where you can do your stretches. Better to find a routine as part of your day to do your stretches. Find a time that is consistent, that you can consistently do your stretches. I don't care. It could be first thing in the morning when you get up. It could be later on the evening when you get home from work. It could be during your commercial break of the TV show you love to watch consistently every day, because that's your trigger that I'm going to do my stretches. It's simple. It's just got to be part of your routine, because if it's not part of a routine, you're not going to see the long-term benefit of it. You can't just do a ton of them all at once and not do it for a period of time. It doesn't work that way. It's that consistency that builds that improvement. So this video is part of a whole series I'm doing on spinal stenosis. So make sure you watch all the videos that are here, because I teach you all kinds of different things in every video. It's all relevant. And if you found this video helpful, make sure you like this video. Make sure you subscribe to our channel. My name is Dr. Ali Shariff, and my clinic name is Infinite Healing Chiropractic and Wellness Center, and we are located in Oshawa, Ontario. And we have a busy practice, and our mission is simple. It is to help optimize your potential, help you be the best you can be. So continue watching our videos, continue learning more. I look forward to seeing you on more videos and educating you. Thank you.